Hello people, in this video let us look at the common causes of raised intracranial pressure. Okay, so intracranial means what? Intracranial means within your skull, right? Within your cranium. Within your cranium the pressure is more. Why? So that is what we will look at in this video, the causes. So basically what is the difference between pressure and hypertension? When do you call it as hypertension? See, whenever pressure is prolonged, high pressure is prolonged for a long time, then only you are saying it as hypertension. Similarly, the terms you can understand here when you are using the word pressure and when you are using the word tension. So no need to get confused, right? Now common causes only we are looking at. What could be the common causes? So when you look at this diagram, you will understand that within the cranium, what is there? What and all can lead to increased pressure. So look at this now. So there could be a mass. So there could be a mass inside the cranium, right? There could be hemorrhage. So that is another thing because of blood, because of bleeding, right? Hemorrhage. There could be venous blood being more, okay? That is called as some problem with the venous sinus of the brain. If CSF is more, cerebrospinal fluid is more. So that could be one cause of increased pressure. Guys, are you getting me? There could be some edema of the brain parenchyma itself. There is some edema. Okay. So all this can lead to increased intracranial pressure. Okay. Let us look at one by one now. So the common causes of raised intracranial pressure, life itself. Okay. Very good. So that you can't write in the exam. Now let's get started. The mass lesions. What is the mass? Some mass means what? Space occupying. Back to physics now. So there could be some blood, hemorrhage, right? So hemorrhage, so there is some bleeding. What and all type of bleeding you have? Extradural hematoma, subdural hematoma, intracerebral hematoma, hemorrhage, right? So hemorrhage, okay? Blood itself is occupying the space. Tumor. Now let's move to tumor. There is something called as gliomas. Do you know this? So basically, let me move this here. So glioma. So there are some primary brain tumors. There are so many type of tumors, right? So let me give you the list also at this moment. So you have meningioma, neurofibroma, colloid cyst also they are seeing here, right? Pineal tumor, so many, pituitary adenoma. There are multiple things. Okay, medulloblastoma, oligodendroglioma. Okay, so many names you got. Very good, very smart. Now move on. Infective causes. Infection is leading to some mass space occupying lesion. What is that? Abscess. Very good. So let's zoom in here a little. So we are looking at this point here, abscess. So abscess means what? Pus filled something. That and all can happen in terms of infection only, right? Then tuberculoma. This tuberculoma sounds something like it is something to do with tuberculosis, right? Cysticercosis, neurocysticercosis if it is in the brain, right? So basically this diagram here. So basically it is because of pork tapeworm, so many cysts in the brain. Then you have hydatid cyst. Hydatid cyst also is tapeworm only, Cainococcus genus. So here you can see hydatid cyst. So basically these are space occupying. So what you should do always? Yes, that is why they give deworming, right? Albendazole, 400 mg, right? They give every 6 months to children. Then colloid cyst in ventricles. This colloid cyst seems to be coming from, even in gliomas they have mentioned this one. Okay. So cyst, all cysts are occupying space. Okay. So that is causing the raised intracranial pressure. Now let's move on to the next slide. Cerebrospinal fluid circulation has some disturbance. So there is raised intracranial pressure. So basically cerebrospinal fluid, if it is more, so you will use this word hydrocephalus. Okay, so it's the abnormal build of cerebrospinal fluid within the ventricles, that is the cavities deep within the brain. So basically there could be obstruction to the flow of to the drainage of this cerebrospinal fluid, right? So there can be obstruction within the ventricular system, or there can be obstruction outside of the ventricular system. So basically there is obstruction causing increased by cerebrospinal fluid leading to hydrocephalus. Okay, let's move on. Next is what? Venous blood. Let's talk about venous blood. So obstruction to venous sinus. So you know the sinus, right? You have the superior sagittal sinus, inferior sagittal sinus. Then you have the, what other sinus do you have? So all this, if there is obstruction again, then there will be build up here, right? So there will cerebral venous thrombosis. venous thrombosis. So again, that is the obstruction. Okay, focus here. trauma which causes a fracture, okay, above the sinus. So there is this depressed fracture which is just above this sinus. So what's happening? The sinus is getting obstructed. So there is raised intracranial pressure because of this obstruction to venous sinus. Oh yeah, very good. Move on. Next. Diffuse brain edema or swelling. We told you why the brain parenchyma is all swollen edema. It has fluid filled. Meningoencephalitis. Itis means was inflammation only, right? Meningitis is about the meninges. Encephalitis, I think, is the brain parenchyma. Then if the person had hemorrhage also, subarachnoid hemorrhage if he has, it can lead to edema, looks like. Metabolic, if there is water intoxication, if there is near drowning also, they are talking about this. If there is diffuse head injury, if there is all this, it can lead to brain edema, brain swelling. Okay, here they have also put one word here, idiopathic, as typical wherever you see, you will write idiopathic wherever you can in life, right? In MBBS, remember. Okay, so basically what they did not mention here is foreign body, etc. Okay, idiopathic they have mentioned, so let's remove this. Idiopathic they have mentioned. What about systemic hypertension? If it is more, can it lead to raised intracranial pressure? That they have not mentioned. But what we can understand is if there is a stroke, hemorrhagic stroke, there is hemorrhage, raised intracranial pressure, right? So that we can understand. So what are the things we looked at as the causes? Let's take a recap. Okay, so the causes of raised intracranial pressure: mass lesions, that is something which is occupying space, like hemorrhage, extradural, subdural, tumors, gliomas, it could be an abscess, tuberculoma, cysts like neurocysticercosis, hydatid cyst because of tapeworm, etc., colloid cyst in the ventricles. Then coming to cerebrospinal fluid accumulating, that could be because of obstruction within the ventricular system or outside. So this will lead to hydrocephalus. Hydrocephalus is usually seen in infants or people who are old. Then coming to obstruction of venous sinuses, this can happen because of thrombosis in these, or there could be a depressed fracture of the skull which is overlying the sinus, right? Then edema of the brain or the swelling of the brain diffuse, that can be because of meningoencephalitis, subarachnoid hemorrhage, water intoxication, near drowning, diffuse head injury, or it could be idiopathic. So that's all for now in this video. In this video we have covered the causes of intracranial pressure being raised.